Interesting session, I think, on refractive surgery. To start with, I think our friend Dr. Shilpa Kodkany, she'll be talking about interesting cases in refractive surgery. Once again, I think we tried our level best actually to get this light off, but uh, yeah, I complained to all the organizing committee also, sir, but they are helpless. Yeah, yeah. Please start, Shilpa.
Thank you so much, sir. And first of all, I thank the organizers for having given me this opportunity. Interesting cases in refractive surgery. Well, there are many, but to cover up in 7 minutes, I have just a few. This is a patient with a minus 6.5 with a minus 1.5 at 180 degrees in the right eye, with a minus 8, minus 1 at 10 degrees in the left eye. She was 24 years old. The pachymetry was 520. Topography was normal. The right eye, with that kind of power, the ablation would be around 130 microns. The residual stromal thickness would be about 320 microns. But we decided to do an ICL because doing a PRK with such high refractive errors not suitable, and even to do uh, femtolasic or a microkeratome LASIK would be going a little too deep, and that's why we decided to do an ICL. So if you can see the chart here, hopefully you can see it. uh, the anterior chamber depth is good. The white to white was 12.5, and that seemed a little odd to me because her cornea was not looking so big. So the lens that we had to put in was a 13.7 lens, which also seemed a little on the higher side. But then I went and did a white to white again and again to check, and I usually use the digital calipers. So I did that, but 2 3 times checked it, and it came 12.5 again and again, and this was what it was. Post surgery, as you can see on the slit lamp, the anterior chamber is really very shallow, and there is a high vault like this. And this is something that I did not, well, I thought that there's something wrong out here, but I still went ahead and did the procedure, and this is what I got. And since it was a -1 cylinder, I even considered rotating the ICL vertically to be able to get a little more anterior chamber depth. That is what we usually do. And then the left eye, of course, we can't go ahead with the left eye with this kind of because both showed 12.5 white to white, the same kind of readings out here as you can see, and 13.7. Of course, I did not want to use a 13.7. I went in again and I rechecked the white to white and confirmed with the digital calipers again it was 12.5. Then I took a calipers, the regular calipers that we have, and we use the ruler to see how much it is, just to confirm it, and it was 12 So I reduced the ICL size to 13.2, and this was what the AC anterior chamber depth was. Definitely, as you can see here, the comparison between the two ASOCTs, the left eye had much lower vaults, and the IOPs also were good. So this is what we see, um, the right and the left if you compare. So the message here is, what I realized after doing this surgery was my digital calipers was somewhere not calibrated. There was something wrong with it, and I had to stop using it, and I went in and got a new one. And I always, after that, recheck with the calipers. And of course, if you have the obs cam, then that is another method of checking the white to white. Now, this is another case with a refraction like this. 29-year-old girl, married, no kids, will have kids in the future. This is the pentacam picture here with a pachymetry of about 500, and you can see that the topography is looking good out here, with the bad score being like this. As you can see, there is this yellow here, which is saying that there could be, like, it's a borderline kind of a case probably, but we don't know. um, this is the left eye, again pachymetry being the same. As you can see, the map looks okay. Again, the bad being like this, where it is slightly on the lower side. So what I decided was, she was a young girl, could get pregnant, have kids later. So I was in fact telling her, you finish all your family commitments and then maybe we could go and do it. But she was very, very keen to do it. But still, we waited for 1 whole year, compared the topographies, and saw that there was no change whatsoever. But then went ahead and did a PRK and not a microkeratome or a femtolaser. Now, this is a very, very interesting case that we had. 53-year-old male with a history of LASIK done 20 years back somewhere, where no details were available about any kind of topographies or anything. The right eye vision was 636, left eye was 618. Both eyes had an NS2 cataract. So the plan was, now you would ask me, why did you go for this toric panoptics? Well, the patient was very, very keen on having good near vision also. So we did all the necessary things. Right eye was operated, patient was very happy. We planned the left eye, and this is what we got. 636, not accepting, no improvement whatsoever. And we did the topography and we found the right eye being okay. As you can see, it was more or less good, but the left eye was showing some kind of a problem. As you can see here, steepening and, okay, can I take 1 minute more? Okay. So a little steepening and a little flattening out here, so this doesn't look very good. And we were wondering what it could be. We did the aberrometry, and this is what you can see, the right eye and the left eye in comparison. And so higher order aberrations, comas, all being there, a little bit of spherical aberration also. So we decided to do a corneal wavefront guided surface ablation for this patient. And after that, see the map. This is what it was pre uh, uh, wavefront guided and post. And you can see that it was, the cylinder has come down drastically. The higher order aberrations have come down. But 2 weeks later, there was a surprise. The patient had 4 by 60 vision, dropped from 636 to 460, and a -5 spherical error. So what do we do? Because what has happened is, if you can see the K readings, 39, 37 has gone to 41. And this is what caused the spherical error to come in. And we decided to go in and do, because the cornea was 520 microns, we did a trans PRK with a mitomycin C, which was kept for 1 minute because there were multiple procedures done on this patient. And the patient got 6/9 part vision with N8 unaided, which finally, even 6 months later, 1 year later now, patient is quite happy with the vision that he's got. So this was another case that we had. Thank you.